Calcium made simple. The goal of calcium is to control the 3 B's, bones, beats, and blood. To do this, calcium's job in the body is to stabilize neuron excitability. So if we have too much calcium, hypercalcemia, that means we have too much control over these neurons. Think of a mom, calcium, who is very controlling over her son, the neurons. So we'll see these symptoms. Now, if we have too little calcium, hypocalcemia, mama calcium is not going to be around to stabilize her neuron children, aka the neurons are going to go wild and we'll see these symptoms.
Calcium deficiency is very common. What does calcium do? Bones, teeth, helps the heart, nerves, muscles, and helps body systems work properly, but needs other nutrients to function. Where is calcium found? Dairy, wheat, and soy flour, molasses, brewer's yeast, Brazil nuts, broccoli, cabbage, dark leafy greens, hazelnuts, oysters, sardines, and salmons that have the bones in them. Symptoms of calcium deficiency: osteoporosis, osteomalacia, osteoarthritis, muscle cramps, irritability, acute anxiety, and colon cancer risk.
If you're taking or plan to take calcium supplements, here's 6 things you need to know. Number 1, you need an overall 2-to-1 calcium to magnesium ratio or your health is at risk. You can check out my recent video on this. Number 2, adequate vitamin K2 is important to help shuttle calcium into the bones, and MK7 is the best form. Number 3, adequate vitamin D levels are important to help calcium absorption from the gut. Number 4, taking vitamin C with the calcium can help its absorption. Number 5, the body can only handle about 500 milligrams at a time, so if you need more than that, you need to separate the dosages. Number 6, taking calcium with high oxalate foods will bind up the calcium and prevent absorption. So foods like spinach and Swiss chard, and chocolate and nuts and seeds, potatoes, soy and soy products, and legumes.
Well, thanks very much for the comment. I'm really sorry for my delayed response. It's been one of those weeks. So I'm going to answer this question, but I'm going to sort of come at it from some different directions. But ultimately, I want to talk about calcium because there's a lot of confusing information about it. I'm going to talk about what the research shows and base it on human physiology. That will include things like vitamin D and vitamin K2, how to get it, how to absorb it, and how to put it in the right places in your body. Remember that calcium is not just for teeth and bones, it's actually also for nerves and muscles as well. Remember that if the body doesn't have enough calcium in the bloodstream, it stimulates your parathyroid gland to stimulate a hormone to get those levels up. And where do you think it gets the calcium from? From your bones. So if the body has no other option, it will actually sacrifice some bone density to achieve overall physiologic function. The challenge is chronic inflammation appears to weaken bones, resulting in either osteopenia or osteoporosis, and next video I'll explain why. Thanks for watching. So in my last video I talked a bit about how chronic inflammation can cause bone thinning. Unfortunately, there isn't like a perfectly simple answer about why this happens. There's actually many complex physiological processes in play. So for example, you can have an absorption issue where you end up just losing calcium in your stool. Or as a side effect of all the inflammatory mediators going on in your body, actually somehow encourages your body to excrete calcium and you end up sort of just urinating out calcium. Very strange. But ultimately, think of it like this. There's a constant race going on in your body between the forces trying to build up bones and the forces working to break down bones. In physiologic terms, it's osteoblastic cell activity versus osteoclastic cell activity. And when you have more bone breakdown, it's because the osteoclasts are winning. And the ultimate goal throughout our lives is to keep this balanced as long as we can. In the next video, I'll talk about how to get calcium. Thanks for watching. Hi everyone, so this is part 3 on the discussion about calcium, what you really need to know. And the focus on today is how do you get it into your digestive system, not into your bloodstream, but how do you actually ingest it? Now, it's of course ideal if you can get it from your diet. So things like sardines have a lot, dark leafy green vegetables, and of course dairy has as well. But of course you can get it from supplements, and the key is to talk to your doctor to make sure, because there's a few forms of it. There's calcium carbonate, there's calcium citrate, and they all are a bit different. We'll talk about that more in a bit. So yes, diet is best, but we'll talk about supplements. Just keep in mind actually that there are some supplements that are actually good if you have a history of kidney stones, and of course maybe always stay hydrated, that's always helpful. In the next video I'm going to build on this and focus on how do you maximally absorb the calcium that you take in. Again, thanks very much for watching, more in a bit. Hi everybody, so welcome to part 4 of things you need to know about calcium. The focus on this video is now how do you get calcium from your digestive tract into your bloodstream? Not did I eat enough calcium, but am I absorbing enough calcium? So what facilitates calcium absorption? Vitamin D. Vitamin D is known as calciferol, and it's known as the sunshine vitamin. So where do you get vitamin D? Number 1, you can get it from your food, which is in the form of D2. You can get it from supplements, which is usually the form D2 or D3, or you can get it by exposing your skin to the sun, and that's D3, and that's why it's called the sunshine vitamin. So how much do you need? Well, you'd like to get your levels between 20 and 50 nanograms per mil. You may be surprised to hear this, but a study from 2011 showed that about 40% of the US population has low vitamin D levels. The key thing to remember is that if your D is low, you're only absorbing about 10 to 15% of all the calcium you take in. Everybody, so this is part 5 of our ongoing discussion about calcium. Specifically, this is the second half discussion about vitamin D. So ongoing research is starting to show that vitamin D is much less of just a vitamin and more of a powerful hormone that can affect complex biological processes like our immune system. But with regard to bones, vitamin D stimulates cells known as osteoblasts, which help build bone. And osteoblasts release a protein known as osteocalcin. And osteocalcin acts like the glue that takes the calcium and sticks it to the bone and sometimes other surfaces. But there's a key issue here. When osteocalcin is first released by the osteoblasts, it's inactive. It does nothing. And it needs a special molecule to activate it. What's that special molecule? Vitamin K. So we're going to talk more about vitamin K in the next video. Thanks so much for watching. Hi everybody. So I think this is the video that a lot of you have wanted to see. This is the continued part 6 of our calcium series and my favorite topic, vitamin K. In the previous video I talked about vitamin D and also about how vitamin K is needed to activate that glue that sticks the calcium to the bones. But the key is there isn't just one vitamin K, there's 2 vitamin Ks. There's K1 known as phylloquinone, and it plays a major role in blood clotting, and you can get it from dark leafy green vegetables. But then there's K2, and that's known as menaquinone, and that plays multiple roles with calcium, and it's therefore involved in bone and blood vessel health. K2 is a bit more challenging to get because it's microbial in origin, in other words, from fermented foods. But in addition to activating that glue, it has another amazing ability. It prevents calcium from going where we don't want it to, like our arteries. How it does this is very cool, and I'll explain in the next video. Hey everyone, so this is part 7 of discussing calcium and my favorite other molecule, vitamin K2. So as I mentioned earlier, separate from its ability to help get calcium where we want in our bones, I mentioned its bonus ability to prevent calcium from going where we don't want, like our arteries and our kidneys, for like kidney stones. Let me explain how it does this, it's really cool. There's a substance called matrix GLA protein, which, once activated by K2, floats around the bloodstream and attracts calcium to it like a magnet and away from the lining of the blood vessel wall. Thus, K2 is like a double whammy. It helps put calcium where we want it and prevent calcium from going where we don't want it. Sorry to make this more complicated, but there's 2 subtypes you should know, MK4 and MK7. MK7 lasts longer, is naturally derived. You can get it in fermented foods, and you want to get 100 micrograms a day. Thanks for watching. So this is the wrap up of the whole calcium, vitamin D, vitamin K2 story. I just want to end this again saying thanks for going along with the journey, but there's just one caveat. So if you're on anticoagulation therapy with Coumadin or warfarin, you need to be aware that K2 MK7 can interfere with that therapy if you take it above 50 micrograms per day. But just know that this doesn't apply to the newer anticoagulants which came out a few years ago, like Xarelto. It doesn't apply to, just the older ones like Coumadin and warfarin. And of course, it is helpful to talk to your provider about this stuff if you're trying new supplements. I know as a provider, if one of my patients was taking this, I'd like to know just because it helps me understand the big picture. So again, thanks so much for following me in this journey. I hope you got something out of it. It was fun to share it with you. Have a great day.
So you've got your supplements, but when do you take them? I'm Dr. Stix. I'm going to share with you 6 of some of the most important things you need to know. 1, fat-soluble vitamins, vitamin A, E, D, and K. They all should be taken with a meal with fat. Number 2, calcium, one of the diciest to take. It can interfere with so many supplements and meds. So at least 2 hours away from supplements, and make sure you check your medications. Number 3, magnesium. You need to take this if you're taking calcium because you need to have calcium to magnesium in a 2-to-1 or even a 1-to-1 ratio. You can take magnesium with or without food. Number 4, iron. It should be taken on an empty stomach with some vitamin C to help absorption. And a professional line product will not cause constipation, and it shouldn't upset your stomach. Number 5, B vitamins should be taken with breakfast or lunch. And number 6, zinc, or any zinc-containing product should always be taken with food to help absorption and also to prevent you from wanting to toss your cookies.
Calcium is a vital mineral which helps to build strong bones and teeth and is really important in heart and muscle function. When you don't get enough calcium, you run the risk of osteoporosis and other diseases. How much calcium do you need? There are lots of foods that are rich in calcium, but we do have supplements available. Choose wisely. Like and follow for more tips.
Calcium plays an important role in the body, but there's some really important information you need to know before supplementing, or you could be putting your health at risk. The ratio of calcium to magnesium is critical, and having a high ratio has been associated with certain conditions, including heart disease, certain cancers, diabetes, and even your total mortality. About 2/3 of Americans don't get their minimum intake of magnesium, creating an effect on that ratio, while in the last couple decades, we've had an increase in calcium intake, which makes that ratio even larger. We optimally want about a 2-to-1 ratio of calcium to magnesium. That's the target. And so before supplementing any calcium or anything else, you need to think about it in the context of your diet and how much nutrition you're actually getting.